Let's look at this image. Now let's go from the top to the bottom. One is the cervical strain, that is the upper cervical region. Now this is a muscle strain at the base of the skull. This is usually from tension or poor posture. What are the treatment? The treatment is heat, gentle cervical range of motion, also exercises, posture correction, short-term NSAIDs. The real fix is correcting daily habits. The second one is the cervical radiculopathy, that is the lower cervical region. The nerve is involved, often from a disc herniation or degeneration. You will hear numbness, tingling, or weakness. What are the treatments? You need to do some NSAIDs, physical therapy with strengthening, possible short-term muscle relaxants. Now, if the symptoms persist or worsen, we need to do some imaging. Third one is the thoracic strain, that is the upper thoracic. This is muscle tightness between the shoulder blades that usually is from your posterior. Treatment is stretching, thoracic extension exercises, scapular strengthening, heat, and sometimes massage therapy. Fourth one is the thoracic spine pain. That is possible red flag condition. This is the mid-thoracic areas. Now, this is very less common. So you need to think deeper if it is persistent. What are the treatments? Now remember, the treatment starts with NSAIDs and physical therapy, but you are actively ruling out serious causes like fracture, infection, malignancy if the red flags are persistent. The next one is the lumbar strain, that is the mechanical low back pain. Now this is most common diagnosis. Remember, it is muscle or ligament strain. Now what are the treatment then? Early ambulation, you need to start walking around. No prolonged bed rest. You need to get off the couch and move around a little bit. Also, NSAIDs, core strengthening, and physical therapy. If the pain radiates more, we need to do some further reassessment. We also have the lumbar radiculopathy. A lot of people also call it sciatica. This is nerve root compression from a herniated disc. The pain shoots down your leg. What are some treatment then? NSAIDs, number one, nerve glide exercises, physical therapy. What if the pain persists? We need to do some imaging, possible steroid injections, or surgical evaluation. The next one is sacroiliac joint dysfunction. Now, this is the pain at the SI joint from inflammation or abnormal movement. What are the treatments? NSAIDs are going to help. Pelvic stabilization exercises, physical therapy, and in chronic cases, SI joint injections or support belts. Next one is the coccydynia, that is the tailbone pain. This is the pain at the coccyx, often from trauma or prolonged sitting. What are the treatments? Treatment actually is pressure relief. You need to get something called the donut cushion. I don't know whether you know it. NSAIDs are also going to help. Push